Hey guys, Happy New Year and welcome back to the channel. Sad news to start off with in 2023 as we hear that actor Jeremy Renner, who's best known for his role as Hawkeye in the Marvel Cinematic Universe, has been involved in a snowplow accident where he suffered from devastating injuries. Reports are that he'd been trying to rescue his car from the snow when he was accidentally driven over by his heavy-duty snowplow that he'd been operating. Now, details of the phone log put to emergency services have helped to shed some light on the immediate injuries that Renner had suffered. According to reports, Renner could be heard audibly groaning in the background of the call made to 911 services, with the claim that the right side of his chest had collapsed and that his upper torso was crushed. Further details highlighted from that log were that the plough had run over the actor's legs, leading to major blood loss. Now, we know that Renner was then airlifted to hospital from the scene, where he was said to be in a stable but critical condition. He's thus far had 2 major operations and he remains in intensive care. But what are the sort of injuries that we're talking about here and what is the outlook from here on? Now, details of his exact injuries haven't yet been released, and I have to say up front that I haven't read any of his medical notes, so all of this is my best guess. But having worked in an accident and emergency department, we would often receive trauma calls like this from ambulances who were notifying us of patients they were bringing in. Now, the purpose for these types of calls would allow us to be able to predict the types of injuries we're going to see and better prepare our resuscitation room with staff such as bone doctors or people from intensive care so that we can best manage those injuries when they arrive in the hospital. So what I'll be doing today is, with all the information to hand, I'll be talking about what types of injuries I might expect and how we'd go about managing them. So first up, the term blunt chest trauma has been used to describe his chest injuries, but what does this mean? Well, put simply, blunt trauma is caused by a dull object or surface, whereas penetrating trauma is caused by a sharp object which penetrates the skin and causes an injury. But exploring this term a little further, blunt trauma tends to stem from forces which cause either compression, shearing, acceleration or deceleration forces, and in some cases it might be a combination of a few of these together. So we've heard in Jeremy's case that he suffered from blunt chest trauma, where the right side of his chest had collapsed and the upper part of his torso had been crushed. And this kind of injury could have occurred from being driven over by the plough or being pinned up against an object in an almost vice-like fashion. And so what type of injuries might we expect from this mechanism of trauma? Well, if we look at the chest and then look at the major anatomical structures in the chest, we have the ribs, the lungs, the heart, and the aorta. So, starting with the ribs, he may well have sustained several rib fractures, and these are incredibly painful. They can be so painful that it can be very difficult for you to take in a deep breath. And as a result of inadequately ventilating your small airways, you put yourself at risk of developing a pneumonia. Now, clinically, the way we look for rib fractures is by taking a history of what's occurred and also examining the chest for any tenderness. They can also sometimes be picked up as incidental findings on a chest x-ray, and in this case, we'd probably perform one just with the nature of the trauma he sustained. Now, the danger with rib fractures are that bony fragments can penetrate into the lung tissue, causing a pneumothorax. Now, what occurs here is the lung deflates a bit like a balloon, and it renders that side of the lung completely useless. The additional worry about a pneumothorax is that as that lung deflates, it can put pressure on other vital structures, such as the heart. Now, the way we detect a pneumothorax is by listening over the chest, and what we're listening for are normal breath sounds. If there's an absence of those, that tells me that the lung isn't where it should be, and there's a possible pneumothorax. And if the patient's really unwell and struggling to breathe, we don't have time to wait for an x-ray to confirm this. We sometimes need to put in a needle to help reinflate that lung. On the other hand, if the patient's quite well, we have time to get a chest x-ray to confirm the presence of a pneumothorax and put in a chest drain in a less urgent fashion. Another danger of rib fractures is if you sustain several consecutive broken ribs, you can develop something called a flail segment. Now, what this looks like is you having several islands of fractured ribs that are no longer attached to your chest wall, and as a result they can come in the way of you breathing normally, with patients needing support with oxygen therapy. So far those are the potential rib injuries that Jeremy might have sustained, and I'm sure you can appreciate how serious some of these might have been. Next up, we've got the lungs. So with a crush injury or blunt force trauma to the chest, we can sometimes see something called a pulmonary contusion, otherwise known as a bruised lung. Now, the problem with this is that it can compromise your breathing, but we can quite easily detect features of it on a chest X-ray. Now, this sounds like a really severe injury. However, the way that we manage it is with supportive treatment. Now, what this involves is oxygen therapy, but in those cases where it's really severe, some people need artificial ventilation on the intensive care unit, which might help to explain why Jeremy had to spend some time on that unit. Next up, we've got the heart. Now, much like the lungs, the heart can get bruised from an injury like this, and we call this a cardiac contusion. Now, the problem with this type of injury is that it can reduce the function of the heart, leading to a low blood pressure and a low heart rate. So people where you'd expect this type of injury to have occurred would need regular blood pressure checks as well as an ECG to ensure that the heart wasn't going into any odd rhythms. And if there was the slightest abnormalities in those checks, then the patient would need a minimum of 24 hours of further monitoring, which again can take place in an intensive care environment. Obviously, if those abnormalities were sustained and there were concerns about your heart rate and blood pressure, then you'd also be in the ideal environment in the ICU to receive IV fluids, medications, or other cardiac interventions. Now, lastly, you have the aorta, which is the largest blood vessel that carries all the blood from the heart to your tissues and organs around your body. What can happen with blunt force trauma is that your aorta may become transected or tear. Now, if that tear is large, it can lead to catastrophic internal bleeding, and you likely wouldn't make it to hospital. On the other hand, if the tear is small, then you're likely to bleed slower into your abdomen, and if not treated, you still could die. So in patients who've suffered similar injuries to Jeremy Renner, where there's a high suspicion of something like this occurring, what you'd want to do is look out for signs of it. One of those signs are an enlarged mediastinum on your chest X-ray, and if this is noticed, then the patient would need an urgent CT angiogram to confirm whether there's been any leak. Now, what a CT angiogram involves is putting through a dye, and in real time you'll be able to see whether any blood is squirting out from the blood vessel. And if a leak was found, then that patient would need emergency surgery to repair it. Otherwise, there's a risk of you bleeding to death. So far we've looked at some of the potential injuries that Jeremy could have sustained to his chest cavity alone. And as I've mentioned there are several vital structures that would need to be closely monitored to help keep you alive, hence why he might have had such a stay in the intensive care unit. But what about his other orthopedic injuries? So we know from one of the reports that his leg was run over. So what type of injury might we expect? Definitely a fracture, but what kind? So fractures can be defined as one of many different types, and it's really important that we classify it correctly because each one requires its own individual treatment. Now, with crush injuries like this, where there's a large amount of force coming down on the bone, we often see what are called open compound fractures, where the bones break and penetrate through the skin. Now, because the bony anatomy gets distorted, you get bone fragments piercing through the skin, muscles, and blood vessels, which means that these types of fractures can bleed very heavily, as recorded in the 911 report. And most patients who have this type of injury will need surgical intervention. Now, this tends to revolve around an open reduction of the bone to bring it back into alignment and a fixation device to keep it there. Now, this might involve plates and screws or rods and traction, depending on the extent of the damage to the bone. And for patients who sustain an injury like this, you're looking at recovery between 6 to 12 months, depending on the severity of the injury. Now, the other injuries listed for Jeremy Renner were just put under the heading of orthopedic injuries. However, I can imagine that he would have had further fractures which would have likely needed surgery also. So unfortunately, that's all we know so far, but I'm sure we're going to get more information in the coming weeks. So in summary, what do we know about Jeremy's injuries? Well, we know that he sustained blunt force trauma to the chest cavity, he's likely fractured several ribs and caused some underlying damage to his lungs and possibly his heart. Aside from that, we know that he's got other orthopedic injuries, with one of them being his leg, and it's likely going to take him several months to to recover from these. Now, reassuringly, in the last few days we have had footage of Jeremy recovering alert in his bed whilst receiving a scalp massage, which is always a reassuring sign. This of course tells us that his brain is functioning and that he hasn't suffered from any severe brain damage, which is fantastic news for an injury like this. Now, I'm going to be following the story quite closely, and if there's any other developments on his health, I will be posting that on my community post on my channel. So if you want to keep up to date with that, don't forget to subscribe and to look out for that on the community tab. Otherwise, if you had any further questions about Jeremy Renner's injuries or any other accidents like this, please let me know down in the comments below and I'll try my best to have a look at them. Otherwise, thanks for watching guys, and I'll see you all in the next one. Thanks.